Guys, in this video we are going to discuss about the lower end of the humerus. The lower end, first of all we need to identify which is the anterior and which is the posterior. For this we can see there are two fossae here. The part which will be having the two fossae, it is the anterior, and the part which will be having the one fossa, it is the posterior part. So the lower end structures can be broadly divided into articular part and non-articular part. The articular part will be forming the part of the elbow joint. The elbow joint has two articulation, humero-ulnar and humero-radial. The articular parts are the capitulum and the trochlea. The capitulum is seen laterally and the trochlea is seen medially. The capitulum is a rounded projection. Capitulum is a rounded projection and it will be articulating with the head of the radius. And the trochlea is pulley shaped and it will be articulating with the trochlear notch of the ulna. Trochlear notch is seen in the upper end of the ulna and it will be articulating with the trochlea and forming humero-ulnar joint. The capitulum, which is a rounded projection, it will be articulating with the head of the radius and it will be forming the humero-radial joint. These two are the articular structures of the articular parts of the lower end. Then we can talk about the non-articular parts which are not participating or articulating with any other structure. So these are 7 in number. These are the medial epicondyle and lateral epicondyle. First to one. Medial epicondyle is seen near to the trochlea. Medial epicondyle is a prominent bony projection on the medial side of the lower end. That is, on the lower end, on the medial side, there is a prominent bony projection. This is the medial epicondyle. And on the same as the medial epicondyle, there is lateral epicondyle. It is less prominent and it is smaller than the medial epicondyle. These are the two epicondyles. Then the medial and the lateral supracondylar ridge. Supra means upper. So the ridge that is seen upper to the medial and lateral epicondyle is known as supracondylar ridge. And this is a sharp medial margin. Sharp medial margin is the medial supracondylar ridge and the sharp lateral margin is the lateral supracondylar ridge. Then here we have to talk about the fossae. Fossae are the anterior surface has two fossae, that is the cornoid fossa and the radial fossa. This is the cornoid fossa which has a deep structure. It is seen above the trochlea. During the flexion of our elbow, the cornoid process of ulna will be lodged here, and this is the radial fossa. It is less deeper, and during flexion the head of the radius will be lodged here. And in the posterior there is also one bigger fossa. It is known as olecranon fossa. During extension it is seen upper to the trochlea, and during extension the olecranon process of the ulna will be lodged here. So these are the main structures of seen in the lower end. Hope you guys like the video. If you want to, do consider subscribing to my channel, and thanks for watching.